Communicating with health professionals while I was pregnant and sort of during the labour process was quite frustrating, as I was trying to get them to understand what I was trying to say, trying to explain how I felt, particularly when I was pregnant with my first and I had a problem with my liver that caused a lot of itching, was incredibly difficult. I need to talk around issues and giving context and backstory, for example, which is really hard when you don't have long in an antenatal appointment. And then having to ring when labour started with my second child and trying to convey what I needed to be allowed to present at labour ward while in labour was incredibly frustrating. And then me, in inverted commas, not explaining myself properly, them not taking the sort of time to understand me, led to an unnecessary epidural on my second. I was actually in transition between stages of labour. So basically the spinal catheter was positioned, but the meds weren't administered because there wasn't enough time. So sort of like some top tips when communicating with health professionals is write down what you want to say and either read it or pass it over. Ask your birthing partner to ring the labour ward and only speak to them when you really need to. Like, they talk to you to hear how you're doing, but that's not entirely helpful if you express pain or emotions differently to sort of normative understandings. And it's their job to try to understand you and to ask you the right questions. But having support from your birthing partner, if you have one, can be very helpful.